Otherwise also, if there is no checkbox, always do cross check in the tabular list. Okay, because only then you will come to know the complete description and all right. Any doubt in this, how to find whether it is complete or incomplete code?
Ma'am, can you repeat? I mean, if there is a checkbox, next characters, I mean, this
It means
781.
next character is mandatory to code, and that character description you will find it only in the tabular list.
Okay.
Okay. So this is about the format again in short. Okay, fine. So format, coming to the ICD code format, they are alphabetic and numeric both mixed. First character is always an alphabet. Again, 4 to 7 can be alphabet or number, but the second and third character is always the number. This is just for your information so that you will not miss out anything. Okay. So the first three character we call it as category. The fourth and fifth is called as subcategory. That is this one. And sixth and seventh is called as subdivision. Okay. Now, how you come to know whether we have to give the fourth character, fifth, sixth, or seventh character is by looking in the tabular list. So, just before the code, if you have any numbers written, fourth or fifth in the circles, then it becomes mandatory to give that particular character. Okay. Another thing is, one second, let me go to the book. Fifth character, sixth character, fourth character, you will just find wherever the code you are looking at. Okay. But if you need seventh character description, you need to go to the category of the particular code. So suppose I will take it as this one, T25.12, burn of first degree of foot. Here you can see sixth is there. Sixth character description is mentioned just below that. Okay, let me type the question. First degree burn of right foot initial encounter. Okay, if this is a question, so first degree burn of foot is T25.12. Now, based on this right foot laterality, your sixth character will be T25.121, burn of first degree of right foot. Okay. Now, it is asking you to give the seventh character. And to find the seventh character, you need to go to T25 category. Just under T25 category, you will have the description of seventh character. T25 starts from here till here it is T24. So T25 starts from here. Wherever the category starts, you have to go to that page. So just below the category, you will find the seventh character description. So this you can see seventh character is to be added to each code from category T25. A is for initial encounter, D is for subsequent encounter, and S is for sequela. So in question, I had mentioned initial encounter. So the seventh character will be So the complete code will be T25.121A. First degree burn of right foot, initial encounter. Only for seventh character, you need to go to the category where it starts. Under that category, see for the description. Okay. But for fourth, fifth, and sixth, it will be just mentioned below, like this. Okay. Only for seventh character, go to the category of the code, whatever seeing. So for T25.12, the category is T25. Yes, Swapna?
Hello, ma'am.
Yes.
Means from where we will know that the seventh character is required after the sixth character.
Here you can see, right? Seventh is mentioned in the circle.
Okay, okay, acha.
So from this, I'll just share one previous 2024 one. I have a colored copy. So from that, it will be clear to you. One second. Refer 2025 only. So just to make it clear, I'm sharing it.
Yeah, even ma'am, in our copies also, we hardly can see those checkbox and those these numbers actually.
Yeah. So maybe if the print is light, it will be difficult to find out. Now you can see. In original copies, this is how it will be. The one what I'm sharing.
Yeah.
It will be in colored. So here you can see sixth and seventh and all. So if you have these numbers just before the code, it is guiding you to give the seventh character.
Mm.
Okay, ma'am.
Okay. Otherwise, one more way how alphabetic index will direct you that next character has to be coded is by looking at this checkbox. Okay. So for S51.021, if you want to find seventh character, you need to go to the category, and the category is S51. Okay. So when you go to S51, S51 starts from here. Here you can see it is mentioned seventh character description. Just below the category, you will find the description of seventh character. There is no major difference between 24 and 25, but there are few newly added codes and few codes are have been deleted. Okay, we have to refer 25, that is actually compulsory, but just to make it clear how it looks, I'm just showing you this. That's it. And next is seventh character. So since I started seventh character, I'll finish this. Seventh character is based on encounter. Encounter meaning based on visit. Whether the patient is visiting for the first time or subsequent times. Okay. Seventh character A, if it is initial encounter. Initial meaning visiting for the first time. D is for subsequent encounter. Second visit onwards, it is considered as subsequent visit. Okay, suppose let's say patient had fracture 2 weeks back, treatment has been provided. Today, the patient is coming only for a follow up checkup. Treatment is not given. Patient is coming for a follow-up visit just to see how the fracture is healing. So since this is his second visit, it will be your subsequent encounter. Okay. And few terms which says it is subsequent visit is: one, follow-up, re-evaluation, or patient visited after 1 week, patient visited the clinic after 1 month. So if you have any one of these statements, it will be your subsequent. Or sometimes they will directly use the term subsequent also. It all depends upon the doctor. Okay. Next one is S. Seventh character S is sequela. Sequela, otherwise it is called late effect. Okay. Late effect meaning patient developed current condition because of previously treated condition, is called as late effect. Okay, for example, let's take patient had nasal bone fracture 1 month back. Fracture has been treated. Now the patient is coming for the bone has been slightly deviated, deviation of nasal bone. And this deviation is because the fracture treatment. Whatever the treatment was provided, the bones was not aligned properly. It has been moved out of its place slightly. Okay, so that is nasal bone deviation. So nasal bone deviation due to previous nasal bone fracture. So deviation will be your current condition, and this condition is because of previously treated fracture code, it will be your sequela. So you will also be coding fracture code, but when you are coding fracture code, you will be selecting the seventh character S to show the relation that the current condition is because of previous condition. Okay, so that is sequela, current complication or current disease developed because of previous condition. Another example I'll give you. Patient had burn on left leg, and now patient is visiting for scar formation on the same site. Okay, patient had burn was treated, patient got discharged, everything is healed. But now the patient is coming for scar formation. Scar meaning a hard skin which develops in the surgical site. Hard and elevated skin. Okay, so first we will code for scar formation since that is the reason for visit. Now to show the relation that scar is because of previously treated burn, second code will be your burn code. Burn on left leg. So, but when you're giving this burn code, your seventh character will be S. So that is how it shows a relation. Okay. In case you are not selecting seventh character S, you're taking it as A. It means that currently the patient is coming for burn treatment, which is actually not the case. Burn is already been treated. Okay. So these are the 3 7 characters major we have. But when it comes to fracture and dislocation, there are many other seventh characters, M, N, P, Q, K, all those. That is based on open fracture, closed fracture. malunion, non-union and all, that we will see in fracture chapter. Okay, but majorly these are the three seventh character description. Initial, meaning patient visiting for the first time. Subsequent, patient visiting from second time onwards for the same condition. And S is the late effect. Okay. Next one is placeholder. Placeholder is denoted by letter X. And letter X has no description. It is just used to fill up the empty space. In other words, it is for future expansion. Meaning for now, there is no description for this. Later in future, they might replace it either with a number or with an alphabet. But for now, we use this letter X just to fill up the empty space when it becomes mandatory to code the next character. Okay. For example, I'll, I'll come back to the page to show you the example. We'll take a simple example. Okay. So let's consider fall from cliff. Okay. Fall from cliff code is W15. Okay. Which is a 3-character code. But next to W15, you have 7th mentioned. But under W15, we don't have description for 4th, 5th, and 6th character. Directly, it is guiding us to give 7th character. Okay, if you just give 7, this becomes your 4th character. Sorry, A. If you give A or D or S, this will be your 4th place, 4th character. But we don't have a 4th character description here. It is just a 3-character code, but asking us to give 7th character. So to fill up this 4th place, 5th, and 6th place, we will use the letter X and then give the 7th character. So this will be the complete code, W15.XXXA. So to fill up the empty spaces, if it is necessary to code the next character, we will use the placeholder X. Okay. Another example, I'll take this one, fall from building. So the correct complete code will be W13.9. We have 4 characters, but 5th and 6th character description is not there. After W13.9, 14 is starting. So further, 5th and 6th is not there, but 7th is mandatory to code. So in place of 5th and 6th, use letter X and then as usual code for the 7th character. Let's take it as initial encounter. So again it will be A. So complete code W13.9 XXA. So this is the meaning of placeholder X, used for the future expansion. Okay, or you can say it is used to fill up the empty spaces when it becomes mandatory to give the next character. Okay, and some codes already have letter X in it. This one you can see, for example, T36.6X. Already X is there. If it is there, nothing to worry. Just go ahead with that. Already 6 characters are there. So just select the 7th character based on the documentation. So some codes already have X mentioned. In some, it is not mentioned like I showed you now. If it is not mentioned and it is asking you to code the next character, in that case, use letter X followed by the character which has to be coded. Okay. So W13 point triple X, say the code is W15, it was what we saw. This is fall from cliff code. Okay. Now next there are few abbreviations, NEC and NOS. NEC, not elsewhere classifiable, or in other words it is other specified. Meaning of NEC is there is clear-cut documentation. The doctor has specifically mentioned the disease condition, but for that specific condition, there is no specific code in the book. That is the meaning of NEC. So when you're searching the code, it will lead you to other specified condition code. Okay, when there is a clear documentation but no specific code, it is called NEC. NEC, you can find it in both alphabetic index and tabular list. Okay, so can go to for example, distortion of ulna, distortion, under distortion ulna, if you see, it is written NEC, Q68.8. Okay, when you go to the same code in the tabular list, it would be mentioned distortion of ulna other specified, Q68.8. Q68.8. So if you come to Q68.8, here you can see it is mentioned other specified congenital musculoskeletal deformities, which it includes all these. Okay, it is just an information to say that the doctor has mentioned it very specifically, but for now we don't have that specific code for the condition. So it will lead you to other specified condition related to that particular site only, but okay. So in tabular list, it will be mentioned as other specified, but in alphabetic index, it will be mentioned as NEC. Okay. Next one is NOS, not otherwise specified. It is exactly opposite to NEC. Not otherwise specified is same as unspecified. Okay, there are specific codes in the book, but the doctor has not specifically documented. Okay, for example, we'll take it as the doctor has mentioned only as cough. So the cough code will be, if you go to cough, the code is R50.9. Okay, now when you go to the tabular list R50.9, no, R50, sorry, R05.9, cough unspecified. So this is NOS. But when we see R05, there are many types of cough. So in the book, we have specific codes, but the doctor has not mentioned it specifically. The doctor has just mentioned as cough. So it will lead you to unspecified. So that's the difference between NEC and NOS. Same way, if you take it as chest pain, okay, chest pain code is R07 category. If doctor has mentioned only chest pain, your code will be chest pain unspecified. But if we see, we have chest pain with many other subterms. Pain in throat, chest pain on breathing, precordial pain. Okay, so if it is specifically mentioned, we will go with this. If it is just mentioned as chest pain, we will go with unspecified. Because the doctor has not mentioned specifically, and there are specific types of chest pain mentioned in the book. So that's about NEC and NOS. There are specific codes in book, but no specific documentation. Okay, any doubt till now? No doubts. Okay. Next one we have is few punctuations. First one is the square bracket. Square brackets, this encloses the synonyms, alternate meaning words. Okay, and this you will find it in the tabular list. Anything which is mentioned in the square bracket next to the main term are the synonyms. Yes, Swapna? Swapna and Pooja, any doubt?
Ma'am, both NEC and NOS not otherwise specified now.
Huh.
Then the disease and condition described doesn't fit in existence of the category, right? So what about the NOS?
NOS is the physician has not clearly mentioned, like documentation is there, but as per now, according to the examination, he whatever he has observed only will be mentioned in the report.
Okay, that means general or unspecific.
It's a, yeah. It is not.
And what about the NEC not elsewhere classified, right? So doesn't have a more specific codes.
Yes. So
So
when we
both
don't
are not
have
specified, na? Sorry.
no NAC is
NEC was
specific.
classified and NOS is not specified, right?
Yes.
Yeah. Thank you.
Oh, next one is the round bracket. This one. So this is called as parenthesis. Parenthesis or non-essential modifiers. Non-essential modifiers or parenthesis. This includes the supplementary words. Any terms which is mentioned inside the parenthesis are the supplementary words, and this you will see it in the alphabetic index, also in tabular list. So for example, let's take it as meningocele. Okay, so this is, here you can see it is mentioned in the brackets, spinal. Okay, or Melkerson syndrome. This is also mentioned in the brackets. I'll go with a simple one, so it will be easy to explain. Let's go with bronchitis. Okay, I'll go with bronchiolitis. So if you see bronchiolitis, inside the parenthesis you have acute, infective, and subacute. So all these terms are inclusive in the main term. These are the supplementary words. Even if it is only bronchiolitis, your code is J21.9. Even if it is mentioned acute bronchiolitis, the code remains the same, because these are the terms which is mentioned in the parenthesis. It is inclusive in the main term wherever you're seeing. Okay, so this is parenthesis or non-essential modifier which encloses the supplementary words. Next one is colon. Colon you will see only in the tabular list. So after colon, if you have a colon after the description, it means the term is incomplete. And to make it a complete term, it will be just mentioned below that. Here you can see code first if applicable, colon is there. And after the colon, whatever the code has to be coded is also mentioned just below that description. So this is an incomplete term. To make it complete, just see the codes with the description below that. So this is the colon. These are the three punctuations. Okay, brackets, parenthesis, and colon. So all this guides you how to sequence the codes.
So, ma'am, 1 second. How to code this particular K60.5 and then K50? No, no.
That I will, next guideline I'll come to
Oh,
that.
okay. Okay.
So for now, colon meaning it is an incomplete term. To make it complete, just see below that. Okay. Now, next one is, I'll go with the same one. Okay, you have code first, use additional code, and code also. Okay. Now, code first if applicable, meaning let's say the patient is having anorectal fistula with ulcerative colitis. This is the condition. So you found the code for anorectal fistula, which is K60.5. And under K60.5, it is directing you code first if applicable ulcerative colitis. So whatever the codes are mentioned below code first will be your first code, and then you will be coding anorectal fistula code, which will be K60.5. So this is guiding you to sequence which one first and second code. Whatever is mentioned below code first will be your primary code, and wherever you're seeing this description, that is this code, will be your secondary code. Okay. And it is not mandatory that you have to give these two codes, any of these two codes, because if applicable, if it is present, code it. If it is not present, just code anorectal fistula code, K60.50. It all depends upon the report. It is not mandatory only because of this statement, if applicable. Okay, so this is code first. Next you have is use additional code. I'll go to J series. There you have a lot of. Okay, so use additional code. Here you can see. Okay, use additional code to identify the infectious agent. Now here you don't have the term if applicable, meaning this is mandatory to code. So there are two differences. One, if you see this statement, and if you see this one, here it just says use additional code to identify infectious agent, but here it says use additional code if applicable. So anywhere you have the term if applicable, it is optional. If it is documented, we code it. If it is not, then just code whatever we have coded for the condition. But in case you don't have if applicable term, it is mandatory to give these codes. Okay. Use additional code meaning this code will be your secondary code. Before coding this, you will be coding J04 category code. Let's say acute laryngitis due to staphylococcus. Okay. So under acute laryngitis, your code will be J04.0. And here you have a guideline saying use additional code B95 to B97. That is for identifying the microorganism. So as I told, it is staphylococcus, acute laryngitis due to staphylococcus. So first code laryngitis code, and then we will be coding the micro-infectious agent code, that is for staphylococcus, which will start in this category, either B95, B96 or B97. So when you go to alphabetic index, infection, under infection staphylococcus, you will get this category. So use additional meaning, first code the condition wherever you found it from the alphabetic index, and whatever the code is mentioned along with use additional code will be your secondary code. This is the sequencing. Okay. Code first, whatever is mentioned under code first will be your first code, and then the category where you're seeing. Use additional code. First code the category wherever you're seeing that code, followed by the codes mentioned along with use additional code. Okay. Third one is code also. Code also, that will also direct you to give the second code. Here you can see code also if applicable any associated condition. So this is mentioned under J16, pneumonia due to other organism. Okay. So if the patient is having abscess or aspiration pneumonia, first code J16 category code followed by abscess or aspiration pneumonia code. If only pneumonia is mentioned, just code J16 category code. So code also, whatever the code is mentioned below this will be your secondary diagnosis. Use additional code also. The codes present with this will be your secondary codes. Only in case of code first, these codes will be your first codes, primary DX, followed by the category wherever you found this guideline. So in this case, J16 category will be your second code. That's the difference between these three terms. Code first, code also, and use additional code. In all these three cases, if applicable term is there, it is optional to code based on the documentation. If applicable term is not mentioned along with the instruction, it becomes mandatory to give the codes. Okay. Any confusions in this?
Yes, ma'am. One question. In code first, it would be considered as the primary code, and in code also, and in additional code, it would be considered as a secondary.
Yes. Okay. Next one is includes and excludes. So here only is, yeah, includes, you can see here. Okay. Includes meaning the terms are included under this the code. So if it is influenza due to other identified influenza virus, all these are included in the same code. So no need to give any other separate code. It is part of this code description. That is the meaning of includes. Okay. Next is excludes. Excludes are of two types. Excludes 1 and excludes 2. Exclude 1 is not coded here. Okay. Suppose, let's say patient is having acute bronchitis due to streptococcus. So your code will be this one, J20.2. And they have also mentioned bronchitis. In the report, you have acute bronchitis due to streptococcus, first condition. Second condition, they have also mentioned bronchitis. Okay. So code for bronchitis due to streptococcus, J20.2. And the code for bronchitis is J40, which is mentioned under excludes 1. So exclude 1 says not coded here, meaning anytime we are coding J20 category codes, we cannot code J40 with these codes. either code J20 category code or J40 category. And how you come to know which one to consider is based on the report. If they have clearly mentioned acute bronchitis due to streptococcus, go with the most specific one. Okay. As I said, point 1 says acute bronchitis due to streptococcus, point 2 says bronchitis. So if you compare these two, bronchitis due to streptococcus is more specific. So we will just code J20.2 because as per the guideline, J40 and J20 category cannot be coded at the same time. So this is excludes 1. You can remember it as not coded here. Okay, 2 codes, whatever is mentioned under excludes 1 and the category wherever you are seeing, those 2 codes cannot be coded at the same time. Next, excludes 2. This is not included here and exactly opposite to not coded here. Not included here meaning these conditions are not included in this category code, J20 category code. So we can code both the codes. Suppose patient is having acute bronchitis due to streptococcus and allergic bronchitis. Okay. So first code, bronchitis code due to streptococcus, and then you will be coding allergic bronchitis code also. Both the codes can be coded. Why we can code both is these conditions are not included under this category. So that is the reason we can code both these codes. Okay, so excludes 1 and excludes 2. Sometimes you might have questions related to this in CPC. Okay, excludes 1 not coded here, so any one code is coded based on the report. Excludes 2 not included here, so we can code both the code if it is documented. That's the difference. And includes, all these terms are included in the category wherever you're seeing.
And in such case, which would be the primary code and secondary?
In which one excludes 2?
Yes.
This would be your primary code, J20.2. Again, primary and secondary diagnosis also depends upon the treatment also.
Okay.
Okay, if treatment is provided for allergic bronchitis, we will code allergic bronchitis first, followed by bronchitis due to streptococcus. Just an example. If treatment is provided for bronchitis due to streptococcus, then this will be your primary code followed by the other code. It all depends upon the treatment.
Okay.
And suppose if it is an radiology examination, mostly it is not treatment based except cancers. Okay, so let's say that they have done chest x-ray and they found patient is having both bronchitis due to streptococcus as well as allergic. Okay, so since allergic bronchitis is mentioned under excludes 2, go with this as your primary code, J20.2, followed by this allergic bronchitis code. Okay, anyways, you can code it actually in that case. If it is just a diagnosed based report, there you can code anything because both are related to the examination. Either of one can be coded as primary or second. Only when it comes to treatment based, whichever condition is treated first or treated, that would be your primary code followed by the other disease condition code. so punctuations, then colon, we are done with, includes and excludes. Exclude one, not coded here, and exclude two, not included here. So both the codes can be assigned in the same report. Any one code is assigned based on the report. Okay, then we have also done code also use additional code, then code first. Next one, etiology and manifestation. Etiology is the cause of disease condition. Manifestation is a condition developed due to cause. Okay, so etiology is the cause. Manifestation is the disease developed because of the cause. So for example, let's take it as UTI due to streptococcus. Now here the condition is UTI, urinary tract infection. And urinary tract infection is because of streptococcus. Okay, so UTI is a manifestation and streptococcus is the etiology. So here also we will have two codes, one for etiology, one for manifestation. Sequencing, always the manifestation first, followed by the etiology. So in this case, UTI will be the first code, and second code to identify the organism causing UTI. This is called etiology and manifestation. Okay, under all etiology and manifestation, you will have these terms, one of these terms. If you go to manifestation code, UTI code, it will be written use additional code to identify the infectious agent. Okay, if you are going to streptococcus code, it will direct you code also the disease condition code. So these instructions, what is given in the tabular list, it will clearly direct you the sequencing. Okay, under etiology, you will see code also, code first. Under manifestation, it will direct you either code also or use additional. That instruction will be given so that you will not miss out the sequencing part. And all etiology manifestation conditions will have two codes. One for the condition, one is cause for the condition. Okay. Next is the term and. And meaning both the conditions are present. Let's say, for example, acute and chronic bronchitis. So your patient is having acute bronchitis as well as chronic bronchitis. So we can code both the codes. So and shows both the conditions are present. Next one is with. With shows the relationship between two conditions. It shows the association. Either it will be mentioned associated with or due to, related to. So with the term shows the relation between the two disease condition. For example, hypertension with heart disease. So it says hypertension is related to the heart disease. Again, we can code both the conditions. Since both are present, we will code for both the conditions. Okay. So that is and with term. Okay. Next one is C and C also. C, C also are the terms which you will find it in the alphabetic index. Okay, I'll take this one. Angioblastoma. So in the report it is mentioned angioblastoma. You're going with the same term, but when you come to angioblastoma, you don't have any code mentioned here. But it is directing you how to find the code using other terms. It says C, neoplasm, connective tissue, uncertain behavior. So just follow the same path how it is leading you. So it is asking you to go to neoplasm. Under neoplasm, see connective tissue. Under connective tissue, go with the term uncertain behavior. Okay. So C will direct you how to find the code using other terms. Another example just below that, angiocholecystitis. There is no direct code, but it is directing you how to find the code. So go to cholecystitis. Under cholecystitis, C acute. It will show you the code. Okay. I'll go to the cholecystitis term. Cholecystitis acute. Cholecystitis is here. Under cholecystitis, it said C acute. So if you go to acute term, you have a code K81.0. Okay. So C meaning it will direct you how to find the code. Next one is C also. C also, it's an alternate way to find the code. Let's take it as angiospasm. Here you have. Okay, so angiospasm, you have a code under angiospasm, and it will also direct you to find the code using other term. So it also says see also vasospasm. If you go to vasospasm also, it will lead you to the same code. But what happens is, Sometimes under angiospasm, you will have other subterms, whereas if you go to vasospasm, you might not have so many subterms. So it is always better to cross check if you have this mentioned. See also, both the cases you will find the code. But the options or the subterms, sometimes it will be mentioned under any one main term. If it is not there under angiospasm, check under vasospasm. Or if it is not under vasospasm, check under angiospasm. If you go to vasospasm, there also it will be mentioned. See also angiospasm. It will lead you to the same code again. Okay. So it is just an alternate way to find the code. So C and C also, both we can find it only in the alphabetic index. Directs to find the code using other term. This is alternate way to find the code. Okay, so these are the conventions. We are done with the conventions. General coding guidelines, conventions, you have to know it. Very important. Anytime you are coding, you have to follow all these guidelines. Okay, first is the format and structure. Seventh character is based on the visit. Initial encounter, first visit, subsequent encounter, second visit onwards, sequela or the late effect. Next is placeholder. NEC, not elsewhere classifiable. When there is a clear specification of the disease in the report, but there is no specific code in the book, it will lead you directly to other specified. NOS equal to unspecified. There are specific codes available, but the report is not specific. Then few punctuations. Square bracket encloses all the synonyms. Then parenthesis, supplementary words, it encloses the supplementary words which are inclusive in the main term. And colon, the term is incomplete. To make it a complete, just see below the colon. Next is includes. The term mentioned under includes are part of the category wherever we are seeing. Excludes 1, not coded here. Excludes 2, not included here. So both the codes can be assigned. Code also, use additional code, directs you to give the secondary code. Code first directs or instructs you to give the primary code followed by the second code. Etiology is the cause of the condition. Manifestation is the condition developed because of the cause. So you will have two codes. And with the term, both the conditions are present, so we can code both the conditions, C and C also. These are the few conventions. If you have any doubts, please clarify. Okay, what about others? Maitri is not there. Abhishek. And punishment. No. All right. Fine. Then no doubts. We will stop with this. Then general coding guidelines will continue tomorrow. Okay. All these guidelines are mentioned in the book. Okay, so I have just given a point, key points. So if you want, you can take a screenshot or note it down, or it's all fine if you go with the book also. Those were the first two pages, and these are the next two pages. Okay. Thank you.